We are beginning the next session now. Would you please be seated?
Good afternoon, everyone. My name is Valerie Goulding, and I've been asked to introduce Bonita Carroll, which is a great honor because she and I are actually partners in some ways with our Ayurvedic practices. So it's a pleasure. Bonita is a longtime Ayurvedic practitioner, I think of about 20 years, and she's been with Dr. Mishra since 1988. She's an Ayurvedic health educator who currently is teaching in Sacramento, California. She's overseeing a 500-hour Ayurvedic health educator program. She's also a licensed esthetician and massage therapist, and probably the list could go on, but I'll stop so that I can introduce her and let her show us how to perform Ayurvedic marma massage using the SVA products. So, thank you, Bonita.
Thank you, Valerie. So this afternoon, I'm going to share a couple stories with you. Is it echoing out there? Yes, but that's all right. Okay. I'm going to share some personal stories. I'm going to show you how to do a prana massage. And I'm going to talk to you about detoxification. So how many people have not heard of the word Panchakarma? Has anyone gone through Panchakarma? Okay, and how many people have gone through Panchakarma in India? Okay, several of you. Okay, so Dr. Mishra we have a very special protocol for SVA Panchakarma. It's very different than the traditional Panchakarma. And next slide. So who goes through Panchakarma? SVA Panchakarma is for those who want to enliven the subtle body and open up the subtle channels. And if you want to have a good detoxification, then Dr. Mishra offers protocol that is very thorough detoxification, that's very safe. Traditional Panchakarma is like a very gross physical type of purification. It's kind of like dynamite, opening up the channels. Next slide. So in Dr. Mishra's Panchakarma treatments, it's a very gradual and subtle, safe opening up of the channels. And Dr. Mishra often is very warning us about traditional Panchakarma treatments because people have had some very bad side effects of it. Some of the side effects that people experience is fatigue, nausea. They get sicker, weaker from having a very heavy detoxification. And often, how many have heard Dr. Mishra talk about how the channels get ruptured if somebody purifies too fast? Well, what does that feel like in the pulse? So we have the subtle nadis. Karina talked about all the different nadis that open up with the marmas. And we have these subtle marmas and these subtle channels called the nadis that prana flows through. And then we have the gross physical channels, the veins and the arteries. And what happens is over time that ama and toxins can clog up these channels, the subtle and the physical channels. And if the channels are not properly prepared to open up, then that toxin can move to another part of the body instead of moving out and cause other problems. For example, if there's toxins in the colon and the channels are too acidic, or there's not a way that the toxins can fully flow out of the body, then they may travel and get stuck in another part of the area, such as the liver. And that can cause more health problems. So I was recently invited to India a couple of months ago to actually consult an Ayurvedic clinic to add some Western advice so they can improve their treatments. And I have gone through Panchakarma many times. The first time I went through Panchakarma was about 30 years ago in a little farmhouse in Fairfield, Iowa. Has anyone done Panchakarma in that little farmhouse? I think a couple of people here. And I was very fortunate. I was about 22 years old, and when I heard about Panchakarma, I really knew that that was for me to go through. I was very Vata, and I had a sense that that would really benefit me. And Dr. Kasturi, who is a world-famous expert on Panchakarma, was the one who was guiding all the treatments at that time. And I got a special treatment where I was covered head to toe with this herbal substance. It was completely black. It had sandalwood in it and all these different herbs in it. And it was very grounding to me. And I had all the other different treatments. So it was a very nice, smooth detoxification for me. But detoxification, if you have an illness, it may not be that smooth, and it can actually have these side effects. So a couple months ago, when I was in India, I had never been to India before. One of the people there who were going through, he was a guest. He had never gone through Panchakarma. He had hepatitis C. And he knew that I had a lot of experience with Panchakarma and Ayurveda. He said, well, are the treatments are supposed to burn? And I said no. And he was getting anxiety before every treatment because the Shirodara treatment, which is an oil treatment over the forehead, was burning hot. And I had known enough about Ayurveda Panchakarma to tell the technicians that no, it's not supposed to be hot, that the head is supposed to be cool. And I had suggested that they get a thermometer so that the temperature of the oil could be in a steady basis. And then also, there's another India buddy here in this room, and she also had a very intense virachana, which is the purging. And what Dr. Mishra does and the practitioners do is to open and alkalize all the channels, so that when they actually go through the treatment is very smooth. Then the actual treatment part happens, and people are going through the actual treatments. There's about 20 different treatments. Shirodara is one of them. It's the oil over the head, and it pacifies Vata. And outside you'll see that there's a Shirodara machine where the temperature is regulated on the machine, and it doesn't disturb the oil. It's a very gentle machine, and it's just a wonderful product if you want to check it out. There's also something called Udvartana, which is a dry paste massage. We also include all the marma points before every treatment, and specific treatments before different treatments such as Shirodara, Nasya, pizza chili, which is an oil bath. There's also an herbal steam bath to open up all the channels. So this talk is limited to about 30 minutes, so this is basically a 3-hour lecture. So if you want to talk to me after about more specific trainings and treatments, then I'm happy to talk to you about that. Next slide. So basically, Panchakarma, the purpose of it is to detoxify the body on a very deep level and to balance all the doshas. And you have to be strong to go through the treatments. Your Agni has to be strong, and you want to maintain that strong Agni during the course of the treatment. And so what we have are the Pro-Pach transdermal marma creams that we use on the stomach every day to keep the Agni strong during the treatments. The Agni is lower at that time of the day, and so what it does is it attracts the excess toxins into the digestive tract. Rather than if you take it later in the day, then the Agni during that time of the day is consuming and burning that ghee. So you want to take it when the Agni is a little bit lower during the day. Next slide. Again, ghee is not recommended for everyone. There's different herbs that may be used for home preparation. And during the 4 days of oleation, apply transdermal cream Pro-Pachika on the stomach area after lunch and dinner, and this keeps the Agni strong. For high pitta people, you want to apply a little bit DGL on the stomach area. Next slide. Also, during the oleation phase, you want to do the Samadhi set on a daily basis. And you can oleate the whole body on a further level by applying DGL and Super Sport to the whole spine, and we would do 7 swipes down the spine. And this lubricates the whole physiology, the whole cellular system. And DGL softens and lubricates, and Super Sport opens the channels. Next. So Virachana, and usually for Virachana, before you would do that on the evening of the 4th day of the ghee, and you will apply DGL on the spine and lower abdomen with Precrete, transdermal creams. You would do this in the evening, and then you can take 4 to 5 Precrete tablets. Precrete tablets are my favorite product that Dr. Mishra has. It's a very holistic type of purification, and it's very mild, and also it really helps with the brain and thinking as well. So this type of gentle Virachana helps to avoid cramps, nausea, connects prana with apana, and gives a higher quality of purification, smoother bowel movements, continuous slow detox by taking 1 Precrete every night during home prep, during the course of the treatments, and then also during post-Panchakarma, and then you would just end after that. Next. Diet during the home preparation, and this is also during the actual treatments. It's a thin khichdi with mum's masala, blended leafy greens, stewed apples for breakfast, whole grains, small beans, pears, and you want to use the spice mix to keep your Agni in balance. Tulsi tea daily in hot water. And you want to make sure when you're going through the home preparation that you don't get weak. You want to maintain your strength. The Agni is lower at that time of the day, and so what it does is it attracts the excess toxins into the digestive tract. Rather than if you take it later in the day, then the Agni during that time of the day is consuming and burning that ghee. So you want to take it when the Agni is a little bit lower during the day. Next slide. Ideally, you want to do Panchakarma in residence. Even the home prep, you can come a couple weeks before to do home preparation. Because it's very easy to cheat on your diet when you're doing Panchakarma out of your home or if you're driving to and from a clinic. Also, driving is aggravating to Vata. When you're doing the treatments in residence, you're very settled. And when you're very quiet and very settled, you're not worrying about any work responsibilities, you're not worrying about the cooking, you're just completely relaxed and open. And when you're relaxed and open, all the doshas, the excess doshas just fly out very easily, all the toxins can easily flow out, and it's very nurturing, you get very, very deep rest. So if you have the opportunity to go somewhere to do it in residence, I highly recommend it. Next. Okay, so the Nasya, before the Nasya treatment, we do the Samadhi set, and then we also do the marma points for the nose on the cervical sinus marmas with DGL and Super Sport. So Nasya is a treatment where you do deep massage to the head, shoulders, face, and then there's steam inhalation with eucalyptus oil, different types of essential oils to open up the channels and the head and the sinuses. Then in addition to that, there are herbal oil drops that you inhale, and also packs on the face, warm packs, and it completely opens up the channels in the head, shoulders, and neck. It's really good for any type of sinus problem, allergies. Okay, next. For Shirodhara, we will do the Samadhi set, DGL and Super Sport on the spine, Brahmi transdermal on the forehead points, Adipat Marma, end of eyebrows and temples. And when you do this before the Shirodhara, it makes a much deeper and more profound experience of transcending. So has anyone had Shirodhara treatment? Shirodhara is just a very deeply relaxing treatment. There's It takes about 20 to 30 minutes where there's a stream of oil, herbalized oils that goes back and forth on the forehead. People usually just go out and go to a very deep state of meditation. It can also be used with takra. Takra dara is made out of homemade buttermilk, and there's herbs in it, and that's usually a tridoshic, very balancing treatment. And it's absolutely fabulous in the hot weather for if you're a pitta head. It's my favorite treatment. It's very relaxing, and it takes out any of that irritability and excess heat. It's also very easy to make. Yeah. Next. So the basti, there's many different types of bastis in Ayurveda. I'm talking about enemas and also dodams. There's a variety of, it's basically an enema that's different herbalized oils in it. And Vaidya recommends that you massage the lower abdomen and lower back with Prakriti transdermal to help just get more out of the actual enema. Next. So after the treatments, normally you receive 2 to 3 treatments a day, and that would include abhyanga, a prana massage with the marma, and then also could be a shirodhara, a steam bath called swadana. It might be udvartana, which is a dry paste massage, or it could be something pizza chili, different, which is an oil bath. There's also different dodams. There's something called netra tarpana, which is a ghee bath for the eye, which is balancing a lochika pitta, which is the subdosha of pitta for the eyes. And what the ghee does, and it's wonderful, you could use the mum's ghee, and you make a little dough dam with dough, like lentil dough, and then you're lying down and you're pouring this beautiful golden ghee with your eyes open. The technician is pouring the ghee into the eyes, and you're rolling your eyes in different directions in this ghee. And what that does is it balances alochika pitta, and it's also for the inner vision as well. So it's clarifying the outer vision and the inner vision. And your eyesight becomes much better. It cools off the excess peat. It's a really wonderful treatment. Okay. So after you do the detoxification, we've created an empty space. We've purified a lot of the ama, a lot of the toxins out, and what we need is rasayana therapy to fill that space. So what you can do is transdermal marma creams such as ashwagandha, brahmi, or other mahamarmi on the head, depending on what the individual needs to fill up that gap. You may, whatever it might be, a bone herb or other type of transdermal that you can apply to the body to fill up the gaps. Because we've cleaned all the gaps, we've detoxified the physiology. And there's that, again, that vata, that empty space, and we want to fill that space up with a rasayana, with something. Rasayana means nourishing, and it's also for long life. So now that the channels are clean, we can absorb and take in what's very nourishing and life supportive, so we have a long, healthy life. Panchakarma is recommended to do a couple times a year, especially if you're over the age of 40. Then you want to have a regular detoxification. Generally, it's recommended to do in the change of the seasons. Okay, so now we're going to demo a Prana, SVA Prana massage, and Corinna is going to be the model. She gets to receive. And Valerie is going to help with holding the microphone so I could use my hands. Yeah. How much time do we have? So basically the strokes, there's going to be, normally it's 7 strokes during the treatment, but because of, I'm not going to do the whole treatment because that will take 45 minutes. Sorry. So normally you would do before you do the prana massage, you would do the transdermal marma massage that Corinna demonstrated yesterday. Okay. I will start with Corinna sitting up, and the reason for this is that I want to access her head for the adipat marma, because what happens is that prana enters through the Adipap Marma, and then it goes down the spine and circulates throughout the whole physiology. And when you're sitting up, it seems to have a more powerful effect rather than applying the products on the head. I can use it before I start the massage. I can do this. Okay, so normally when you start a massage, you start in silence, and you can take the person's pulse. If you don't know pulse, it doesn't matter. Just hold the pulse, because our attention is what creates the effect, and our intention and our attention both. So just holding the pulse for just a minute and making your first contact with the client, and also just by your attention on their pulse, helps them to settle down. They may be just maybe having some excess vata going on, and just by holding the pulse will just help to settle. And it'll settle you too. It helps you to connect to your client. At this time, you can also say a little chant or a mantra. It's very nice to have 1 to 3 minutes. You could play it in the background, or you can chant it yourself. You can say it silently. I really like it when it's chanted out loud. It benefits the whole environment. Okay, so what I'm going to do is I'm going to start the treatment after I do the chant. I don't want to sing to everybody. So I'm so what I'm going to do is I'm going to have some of the Blissful Awakening spray. I'm going to pass this around the room after I get done with this, so you can just spray some on your face. And what this does, it wakes up the channels, and it just calms and balances the system. So don't put it on her, I'm just going to block her eyes so it doesn't get in her eyes. I first met Maija at the Health and Wholeness store in Seattle, Washington in 1998. And he taught me everything about Ayurveda and about herbs. And I was the one who was designated to drive him around. And he showed me how to cook food, and I took notes for all the patients. This is how I learned, is sitting in the room with him when he took pulse. And I got to take all the notes. And I had to make sure he was on time to places and drive him around, which was really interesting and just deliciously fun. Okay. So the other thing I'm going to offer my client is some organic rose memory nectar. And what that does is it opens up the heart. And it opens up the heart and the technician as well. So we're both going to take a sip of this. You just take it 1 drop in a glass of water, or you can put it directly on the tongue. You can use, your SVA practitioner may recommend any type of memory nectar. I particularly like the rose nectar because it creates a beautiful feeling in the heart and opens the heart. Normally you would have all your oils warmed up. I use a stainless steel cup on a electric coffee cup warmer, and that keeps the oil warm. So I'm putting this, applying right on the Adipap Marma, and just applying the oil first there and holding. You can go back to slide 13. So normally I spend about 5 minutes making sure that the scalp is fully oiled, and that really balances prana vata. So when I was in India, they were slapping the head really hard for about 20 minutes, and I was like trying to get my head away. Everything is very calming in this type of treatment. Again, I'm not going to go through the whole treatment. Usually it's kind of an improv massage, but the idea is you want to make sure every area of the scalp is being touched, and there's plenty of oil on. And this is very balancing, again, for the Prana Vata and gets the treatment started. The next product I have here is Karna oil. Ears for about 5 minutes with this. And then I also have Ingala Pingala nasal oil. And the reason that we're going to lubricate the nostrils and the ears and the different openings is because there's a lot of dryness. This is happening due to EMF and EMR. So the electromagnetic radiation is mixing with the prana that's drying out all the channels. And so what I'm going to be doing is just lubricating all the channels and applying these specific oils that Vaidya developed specifically to balance those senses. You could just take a dropper and you go all the way around the different curves of the ear, and then then I can be massaging them. Again, it's about 5 minutes total on the ear, and it's kind of an improv, but you're massaging every part of the ear, all the little different points on the ear. There's a lot of marma points along the different parts of the ear. Next, I'm going to be putting a drop in of the Ingala Pingala nasal oil. And you just need 1 drop. Really amazing to use nasal oil. It really lubricates the brain and the sinuses, any dryness you have. If you feel any mental dullness and you just put a couple drops of the nasal oil, just sniffing it in, it really helps to clear out foggy thinking. It's really great in the middle of the day just to put a couple drops in your nostrils. You don't have to be getting this massage. Product I'm going to be using is Lalita Nourishing Facial Oil, and I'll be doing a face massage with that. The next product I'm using is called a Detox pouch. There's a lot of dried herbs, and you can put this detox pouch normally in a bath and soak with it to help with the detoxification process. But what I'm going to do is just moisten it a little bit with you could either use Super Sport Mist or the Blissful Awakening Mist just to dampen it, and then I'm just going to massage downward strokes before they actually start the oil massage. 7 downward strokes with the pouch, and the mist is somewhere in the midst of the audience, so it's a dry pouch. So I'm starting from the very top of the shoulder and going down to all the fingertips. So here it is. It's a little bit cold in this room, so I'm going to try to keep her covered. Normally the room would be very warm when you do any type of treatment. You have to keep the temperature of the room warm. And if you're a body worker and you want to come up close, you're welcome to bring your chair right to the front to see it. The detox is just a gentle purification and opening up the channels. Again, we've already done the marma point massage before we actually start this prana massage. So I do recommend that you do all your treatments in silence. It's very balancing. People often have an experience of transcending. If you want to play chanting, I usually do that in the rest phase of the treatment. And the rest phase of the treatment is just as important as the treatment. Really, a lot of the magic happens during the rest time. The rest time is when a lot of stress is releasing from the physiology, and a certain balance, kind of a magic, happens during that rest time phase. So I usually have them rest about 20 minutes, and during that 20 minutes you can play the chanting. So I'm going to be using some SVA Abhyanga oil. Going to be circles on the joints in a clockwise motion, and then I'm going to be doing downward strokes, 7 strokes. I'll just do 2 strokes because of the time. Again, every time you approach the body, you're very aware of not knocking the person and approaching them in a very conscious, very gentle way. The more attention you have the person, the more present awareness you have with your client, then it really makes a very profound, deep experience for them. And the more inner silence you have from your meditation practice, your own practice of Ayurveda also has a very big effect on the type of treatment that you give. So Ayurveda says that the technicians are a very important part of Panchakarma. And the reason for this is that the Panchakarma technician spends more time than the doctor does. They're with the patient maybe 3 or 4 hours every single day for weeks at a time. So the technician really understands the body in a very deep way, differently than the doctor may, because there's so much time and you're really getting into the depths of the person's layers of their tissues, basically. I'm going to be doing upward strokes on the neck for balancing Udana Vata, and then I'm going to be doing the chest. Normally you will do the breast, depending on what state you live in. So I'm just going to go around instead. So I do clockwise around the breast. And then I'm going to do the abdomen. And you have to approach the abdomen very gently. A lot of people are very sensitive. There's a lot of emotions, and you have to go very carefully to approach this area. I'm doing clockwise circles, and it's not deep, it's just a medium pressure. I'm going to lay one hand on the Kurma Marma, this is on the navel, and then one on the heart. If the person has arthritis or sore joints, you can use a more specific oil on that joint, maybe Super Sport or some other transdermal that Vita may be prescribed. You can spend about 5 to 10 minutes massaging the feet. It's more of like an improv on the feet. Again, it's not real deep, it's medium pressure. People really feel very relaxed. I think people are getting sleepy just watching this massage, getting some benefit just looking at it. So you want to spend plenty of time on the bottom and on the front of the foot. Usually spend about 5 minutes per foot. So you can use Super Spurt in 7 strokes across the neck. And now we're going to do the back. And the back is basically, we're going to start from the neck and go all the way down to the base of the spine, all along the spine. And then after 7 strokes along the spine, you're going on either side of the spine and then further out. Again, it's all 7 downward strokes. You can also do a two-person pranic massage, and then it's like the four-armed goddess, because you have 4 hands on you. It feels really totally amazing. From there, I'm going to do the back of the arms, just downward long strokes again, about 7 times. And you know, this massage can last 45 minutes to an hour. If you're doing a 30-minute transdermal treatment before this, then you can spend about 45 minutes. So the total will be a 90-minute treatment with the transdermal and the pranic massage. I'm going to end the back by holding the base of the spine and the Adipat Marma. And I'm just going to spend like just a minute just being aware, having aware presence. Aware presence is what is very settling for both you and the client. You want to make sure you always cover them whenever you're not using or massage. I'm going to end this particular treatment with another mist of the Blissful Awakening to further open up the channels. She's very settled right now. And then what I will do is let her rest for about 10 minutes. If she's getting another treatment, for example, Shirajara or a Svedana, then she would rest for 10 minutes and then I would give her the treatment. If she's not getting any other treatment, then she'll rest for about 20 minutes. And this treatment, it could be done by anybody. You don't have to be a Panchakarma therapist. You could offer this for your spouse and do it on each other. It's just really a beautiful gift to offer your partner. I usually just end a treatment by holding their heels or the bottom of the feet, with just ending in silence, maybe ending with a blessing for the person.
Okay, so on the spine you use Super Sport. Then when you did the neck and arms, did you go back to the oil or stayed with the Super Sport?
I used an oil. So I used for her Vata oil. You could use Pitta oil, the men's rasayana oil, the women's rasayana oil, the oils with magnesium and vitamin D in it. There's a whole variety. Now, if somebody has more kapha, Dr. Mishra created a bitter oil massage, and it's very heating. It's very good for kapha, but he recommends that you just use that on the legs because you don't want to heat up the upper body too much.
Okay. And then your only upward stroke was on the neck?
Yeah, for Udana Vata, it's
Okay.
Udana is moving in this direction.
Okay.
Yeah.
Perfect. Thank you.
I want to invite everybody to Peaceful Meadows Ayurveda, which is in Grass Valley. It's in Residence Panchakarma. Again, it's for deep rest and rejuvenation with a mild detoxification. If you have a specific health condition, then you need to consult with Vaidya or any of the other, Dr. Beach or Dr. Teitelbaum, for a more specific type of detoxification that they could do. You could do at Peaceful Meadows, but with more specific prescription. So, yeah.
Bonita, as an old school Panchakarma technician, I haven't done PK for many years on people. I see that you're doing a pranic massage, and it's much more gentle and kind of general than what I was trained in years ago. Is part of what you do does it involve any more kind of a traditional abhyanga?
Well, that's why I spend a lot of time on a head massage and the feet and the ears and also the face. But Vaidya, I asked Vaidya about this because everybody loves a really, intense abhyanga. But he said that it's not necessary to do a lot of pressure because we're already opening up the channels by first doing the transdermal marma points. We're doing maybe 30, 40 minutes of transdermal marma points. So it's not necessary to do a deep abhyanga. But we do satisfy that by spending more time on the feet and the head and the ears and the face. Yeah.
Thank you so much for such a beautiful presentation. I have a question about what you mentioned about taking ghee butter from mom's ghee, taking 6 to 7 in the morning. Did you mean that it's only for the period of when you're preparing your body for Panchakarma?
Right, that's for 4 days of oleation, and what that does is it softens the excess doshas, and it helps to soften the impurities, and it draws them into the digestive tract. Then you do the Virachana with the Prakriti tablets. Prakriti tablets are baby haritaki soaked in castor oil, and you can take several of those, and that helps to further eliminate the toxins from the body and softens the toxins so that when you go through 5 to 7 days, 20 days of the actual body treatments, then the channels are already prepared and opened.
And taking mom's ghee, do you need to melt it first or as is from the jar?
So I just want to make a caution here. So not everybody is recommended ghee for oleation. It's best to see a practitioner to make sure. But if you are recommended, you can melt the ghee, just heat the ghee. You can put it in a little warm skim milk because it's easier to get down. Yeah.
Thank you.
Any other questions? Bonita.
Okay, thank you very much. Okay.
Na takadimi takita tatang takadimi takita tatang takadimi takita tatang takadimi